Good evening, everybody, and I welcome all the audience first on the show with my panelists. The topic which we are going to discuss is a brainchild of Krishna Bhai, who in the middle of the night came something to in his mind, maybe a dream, what is a placebo and why we should not talk about placebo. He made all the outlines, agenda, what is required, and a name given a convinced might gave. When I was going through literature, it is very, very interesting. I am sure by the time we finish this topic, a rare topic, you all will be very happy. So, before we switch on, I introduce my faculty. First of all, the Krishna Bhai, who will take few minutes to start, and then my panelists, who are so strong and witty, you will enjoy their humors and believe it. For the introduction, I told they make a group on group. I said, do we need slides to introduce? He says, naam hi kafi hai. So we do not want elaborate things. Names are Atri, Gangopadhyay, Agam, Vora the Great, Ravi Bhai from Indore, and Radha Didi with Vijay Kumar Chinmachitti. And I am sure with all strong presence and strong names, the whole CCI knows, and I think more than this, they do not want, and I also will not waste the time. Nami kafi hai. So now switch on to Krishna Bhai.
Namaste, long live CCI, Jai Shri Krishna. So, actually, I am quite fortunate to have today that when I planned this topic, I thought that I need certain brains beyond academics. So, it's like, no, you choose your cast when you make a movie. So, that casting, I was very specific that I need such people only, and I'm extremely happy to have such brainy, productive people like Dr. Rakesh Chawla, Dr. Radha Munje, Agam the Great, and Ravi Dosi, my dearest younger brother, and Atri. So, beginning with, even before I begin this, what I'm going to tell now, I'm happy to tell that we already have 1,800 plus people registered, and they are, at the very beginning, we have this much number of people watching us. So, the topic is here, that is placebo, and it was since a long time whenever I used to be a spectator watching any presentation or seeing any studies, I always used to see that placebo is compared with the new drug before the launch regarding the efficacy. I was surprised to see in almost every studies that placebo also healed a significant number of people. So I was surprised that compared to the drug, placebo has also done some job. Definitely, if the new drug has its efficacy equal to the placebo, that is perhaps not entertained to enter the market. If it performs greater than the placebo, it is effective drug. But however, with people who are getting better with placebo also for various types of illnesses in the world. That was what I noticed probably 2-3 decades ago. And that was always in my mind that placebo also used to treat, and it can also heal. Well, I'm here to tell you people a story other than discussing in detail, because there are brainy people over here who will do the job neat. During our student life, or probably when I was a child, I think perhaps my dad told me a story. That story is in a movie theater, in a movie hall. A very popular movie has got released, and there are people house packed, that is house full. However, what happens, a person sitting in a row starts screaming of pain abdomen all of a sudden. So the movie is newly released, everyone is interested to watch. That person is neither leaving the hall nor he's allowing others to watch, because he's continuously screaming with pain abdomen. Then what happens? Fortunately, in the previous row where he is sitting, a doctor is sitting, and doctor gives him something in his hand. He tells, keep this in your mouth till the movie ends. Do not bite it, do not chew it, just keep it in your mouth. It will start acting for your pain abdomen. After a few minutes, the pain abdomen vanishes. Then when the movie ends, he thanks the doctor. He tells, thank you so much, doctor. My pain abdomen is no more there. How did you even imagine that someone will develop pain abdomen in this movie hall and you brought that medicine? The doctor tells, I did nothing. I just gave my shirt button to you. So that faith that a particular doctor gave something healed that pain abdomen of the patient. This story I had heard way back. Moreover, till date, I have seen so many people. I'll tell you, because now the era has changed. I started my practice perhaps 25 years ago. I started my practice. The era is different now. Then faith was the only module. I have seen in periphery, people were getting better with one vitamin B complex injection, giving IM and sending the patient home. When the general practitioner had no clue, I've seen that. I've seen those days also because I started with general practice. And then now I'm a consultant. A particular perfect drug is written, a particular perfect lab investigation is written from a periphery general practitioner. The people do not believe him, neither they undergo that investigation, nor they buy that drug. Even when they buy that drug, they are in doubt. So perhaps they may not feel better. But the same person, when he comes to a consultant or a secondary, tertiary, quaternary center, when the doctor advises him the necessary investigations, he gets every investigation done. The doctor will write the same medication, probably with a different brand name, and the patient will buy it also, will feel better also. So this is called the faith cycle. We must have heard this. Perhaps just think of this. They will straight away tell you in a small city, sir, please refer me to Bengaluru to some doctor. Refer me to Delhi to some doctor. Here, before the doctor, the name of the city comes in priority. So whoever is treating at Delhi, I don't know, but refer me to Delhi. That particular small town people, he tells to the doctor. No, see, there is a consultant who does the same job here. You want to see him here or you want to go to some other place? Sir, no, sir, no, sir, no, sir. I will go to Delhi. So that Delhi brand name or some brand name like Manipal, people are so obsessed with that they are very sure before reaching there that I'll become all right. So there are two things. One is the place, the brand name of the place. Then the brand name of the doctor also is very important. You can easily imagine that someone visiting Agam will become all right at first instance. The same thing goes to Rakesh Bhai also. Because they are very confident. The moment they come to you, they know that they are seeing Rakesh the Great, Agam the Great. So they are prepared to heal and come. And this is called as the endorphin releasing. The endorphin, when they release, I'll tell you guys, this is very frank. We know it all. Any wound, any surgery, any suturing, any post, it will heal by its own. The body has the mechanism to heal it. We only aid so that no secondary infection sets in, no extra problem sets in. And that feeling well, having the endorphins released, is the actual healing pattern. If a perfect OT is done, my teacher, the famous surgeon, was telling me that if a perfect OT is done with zero infection OT, in zero infection OT, if you are very sure that post-op care is very good with zero infection, you don't need an antibiotic after the OT. He used to tell me, you give pre-operative antibiotic and post-operative antibiotic only for the reason that you are doubtful or you do not want to take the risk. So the healing is very well inside us. We only need to aid it. And doesn't mean that you never visit a doctor, you don't take any drug. But as I told in the objectives which I have written, the highlights which I have written, doctor, drug, and deep belief triad. This triad is very important in the healing process. If the patient doesn't have faith in you, he may not become all right with the drug of choice also. So building a faith. And you must have seen or not, I don't know, you must have seen, there are some stubborn faced doctors looking at whom no, the patient will never become all right. And they don't even talk nicely with the patient, and they don't even discuss properly with the patient. Like someone like probably Agam could be the best choice, who just, अरे क्या रे क्या हुआ रे बैठ रे अरे बस इतना ही ना छोड़ ना रे बैठ और घर में सब ठीक कुशल मंगल. See, my God, tremendous improvement. And the staff of the doctor, if they are also like stubborn faced, like what you call as stone faced, doesn't go well. The patient will feel good the moment he enters your clinic. The atmosphere, the staff, the doctor, how they are talking to you. That is very important. And placebo can create some wonder, not every wonder, when all these triad works brilliantly. Probably I will try to hop in the meanwhile when this discussion is going on. However, now I will hand over this to Dr. Ravi Dosi for his presentation. And Ravi, I told him, I telephoned him a week ago. Ravi, देखना, एक काम करना है भाई, तो मेरे लिए एक presentation बनाएगा. मेरा ये idea है, तो ऐसे बनाएगा. I am very dull in this, okay? Bas, what is my idea? I'll tell. PPT and all, I never make. The people, they are very good, they make. So now we'll go ahead with Ravi's presentation, followed by which, again, our moderator, Rakesh Bhai, will come into act. He will start asking questions. I request everyone here, except Agam, I will tell to everyone, because Agam ko bolna nahi hai mujhe, be jovial. Agam is born jovial. So let's hope we'll have a jovial talk today. We have now, 1 second, 1957 already watching us. Call it a day. Go ahead, Ravi. Come on. Presentation, please.
A very good evening to all my respected seniors and colleagues, and to all the viewers of today's extra special CCI webinar, which covers a very, very important aspect of the placebo system of healing and how we in modern medication are knowingly, unknowingly using this to help our patients, and how the patient's psyche is so important and his faith is so important so that it helps us heal him in a more effective way. Placebo is a Latin word and it means literally to be an inert medication. It is usually given as a pacifier or as a control in experiments. I am Dr. Ravi Dosi. I come from Indore, Madhya Pradesh, and I would like to thank Dr NH Krishna sir, Dr CVK sir, Dr Atri, Dr Shivani and Dr Kirat, Dr Narayan Pradeep for giving me this opportunity to talk on the platform of CCI about this so very interesting topic. My today's talk deals a lot about what are placebo, the patient characteristics which help us improve placebo results, relationship between patient and clinician, which is so important, characteristics which the clinicians should have, what are the types of placebos that we use, what is the healthcare settings where placebos are better used, how much time do placebo take, and what are the expectations from a placebo. Well, all of us, if asked upfront, will definitely say, I don't use placebo. But when we analyzed and looked at studies which look at prescriptions, it was seen that 77% of specialist physicians and 63% of general physicians regularly prescribe placebos. More than 90% prescribe impure placebos. What they are, we'll be talking about. And the usual disease in which the placebo is prescribed by these doctors are usually psychiatry related issues and pain. Pain which can be both surgical as well as non-surgical. The most important aspect which is seen as far as placebo is concerned is the lack of faith. We often see that patients are more interested to take a second opinion, even though you, as their primary physician, have advised the perfect drug, but it just doesn't work. Whereas the same advice given by a senior doctor, or at times a doctor who in behavior is more empathetic, or as per their psychology looking more doctor like, automatically results in the drug work doing wonderfully better than when it was prescribed by you. Well, this is where the origin of placebo starts. Placeboism is very deep rooted. Why so? Because we are surrounded by traditional healing systems which guarantee you cure with no side effects. And they keep on going on. The patient keeps on taking on for their disease and feels very happy and satisfied. Western biomedicine claims to eradicate disease, but in actuality, there are very few diseases except infections which we can actually cure. And with the coming of diseases like long COVID, even that perfectionism of Western medication and medicine system is now at a question mark. The other very important aspect of Western allopathic medication is reductionism. What is reductionism? Is coming down to the molecular level from the body. You tend to talk more about biopsies and specific molecular targets, which makes the evaluation time longer, the patient suffering increases, and at times this higher scientific medication is more side effect prone. And definitely, because of the fall in infectious diseases, there has been a rise of chronic diseases. These chronic diseases are rarely cured by the Western system of medication. So placebos automatically find a more relevant place in our prescriptions and in the patient's faith system. Placebos are not new. Howsoever, we may claim of never writing a placebo, but placebos have been written from a very long time back. They have been mentioned in ancient text, but more relevant mention has been done by John Haggard in 1799 when he printed a treatise evaluating and emphasizing the role of placebo in treatment. There have been several famous placebo-related medication which has been used, like bread pills, sugar water, cold vaccine. Saline is so common. Not a day goes by when you get a call or a patient tells, "Doctor, bottle laga." This bottle or saline is even marketed in the Western world as saline pubs, and they are very busy places. There is a very famous example in literature where goats' testicles were sewed to people who were suffering from impotence, and they claimed that it actually causes fertility to rise. Dr. Breacher in World War II elicited a placebo experiment in which he did a study also, whereby on a busy battlefield where there were lack of supplies, in soldiers who were injured, he actually injected saline and put saline as a placebo for a painkiller, and he observed that a good number, almost 33% of patients experienced pain relief when even given simple saline. This was one of the most important documentation of the power that placebo has in pain and analgesia. Placebo comes in all shapes and sizes. They come in the form of pills, they come in the form of injections, and even surgery, which we'll be talking about later. 40% of prescriptions are filled up with placebos, which can be pure, like starch, dextrose, maltose, lactose, talc, mentholated water, or saline. Or more commonly, they can be impure, which are pharmacologically active substances like vitamins, minerals, antibacterials given in a setting for, like, let's say, viral conjunctivitis or pure viral rhinitis, psychotropic substances, which we write just so that they can improve their psychology, memory, and inattentiveness. A lot of us tend to practice this, but we hardly acknowledge the fact that we are actually prescribing placebos. The commonly prescribed placebos are medicines at doses lower than those recommended, antibiotics for uncomplicated flu, antibacterials for clean skin wounds, joint cartilage regenerators for osteoarthritis, vitamins, phlebotonics, which are advised in hemorrhoids, cerebral vasodilators, psychotropic drugs and anti-aging substances, and even a few papers claim that most homeopathic remedies are placebogenic. The use of placebo may be useful, but where? When the physician does not know what to do and all the therapeutic resources have exhausted. In the absence of any effective drug for the problem. In cases of patients who periodically and insistently demand a prescription for ailments which are difficult to justify, and in helping to reduce the dosage of chronically prescribed drugs by reducing the incidence of serious adverse reactions, many physicians find it quite justifiable to prescribe a placebo. Placebo, as we have discussed, are substances and interventions which lead to a beneficial outcome after administration or application. Placebo response is the favorable health change which occurs from taking the placebo, and placebo effect refers to those particular beneficial health changes which are observed after placebo administration. But where there is a placebo, there is also its other cousin called its nocebo. While a placebo gives positive effects, a nocebo gives negative effects, causing worsening health and poorer outcomes. Nocebos are given unknowingly, inadvertently, but they cause a lot of side effects like nausea, dry mouth, drowsiness, anxiety, nervousness, headache, dizziness, flashing, flatulence, low BP, and to the feeling of heaviness, which are variable in intensity, and they are reminiscent of adverse reactions caused by psychotropic drugs. This can be drug-related non-specific toxicity. The more famous nocebo effects have been studied in statins, where it is told that if 100 people take statin for the purpose of reducing heart failure, hardly 2 will get the benefit, 98 will only face side effects. And is the same with COVID-19 vaccinations, where we all face the same common question day in and day out, कि sir ये COVID के vaccine से तो नहीं हो गया. These nocebo effects have non-specific mechanisms. They are triggered mostly by negative psychological stimuli, and there is an activation of the hypothalamic pituitary adrenal axis in them. Nocebo effect is more common in patients with pessimistic personalities, those with a tendency to somatize their emotions, information on adverse reactions when they read in their leaflets, and when a negative information about the same has been circulated in the media. Females, unfortunately, tend to experience more nocebo effects than placebo effects. Placebo have action by non-specific, non-receptor mediated mechanisms. They have variable latency, variable effect. You can only prescribe a known effect for known drugs like aspirin and codeine, but not for others like sugar pills and colored water. They have a fixed dose response relationship. There is a law of all or nothing in which either the effect comes or it does not come. At times, even placebo experiences tolerance and addiction. Patients tend to get stuck to it. We have seen that they have adverse effects. The psychology of the patient can reinforce or reduce the effect produced by pharmacotherapy if they think better, then drugs like remifentanil and caffeine work more. Whereas if they show or think that the drug doesn't work properly, then even when a drug like remifentanil is given, the patient will not experience analgesia. Different types and centers of the brain are involved in this particular placebo effect, be it the cortical area, the subcortical area, the hippocampal area, the hypothalamic pituitary axis, and several enzymes and neurobiological mechanisms like endogenous opioids, non-opioid mediators, CCK, growth hormone, ACTH, have been known to be effective in the mechanism of placebo. There are several factors associated with the placebo. One is the drug effect. How is the capsule? How is the color? How is the flavor? How is it looking? Is it given in solid, liquid, gas, or even in a suppository form? There is a halo effect. That means what you think about or know about the drug prior to the drug being given. What is the price of the drug, whether it is a generic or a company one. Patient dependence is a very important factor. There are placebo responders and then there are non-responders. It is not associated with their age, gender, or cultural level or ethnicity. It is more of a personality profile. Optimistic people have better response to placebo as compared to pessimistic. And then there is prior conditioning, which is more seen in pediatric population, in which the environment and place where it is given, the person who is giving it, whether the patient seems that this particular drug will be giving him great benefit or not. That is very important. The patient's positive expectations have been shown to increase their effect, whereas negative expectancy abolishes their effect. In relation to prior conditioning, it has been seen pre-administration of opioid analgesics promotes the onset of analgesia. Regularly you give them, then one day when you give a placebo, even in the presence of an opioid inhibitor, you will see that the patients will experience analgesia. So the placebo effect is a learning phenomena in which many factors come into play. That is very important. Believing of becoming well itself releases endorphins. The famous endorphins which give benefit are dopamine, oxytocin, serotonin, and endorphin itself, which acts like an analgesic. The nocebos are involved with decreased secretion of opioids, decreased cannabinoids, decreased dopamine, and more cholecystokinin, whereas placebo are just the reverse with more of opioids, more of cannabinoids, more dopamine, more oxytocin, more vasopressin, and more noradrenaline. Placebo analgesia is governed by both opioid and non-opioid mechanisms, which were evaluated by the administration of naloxone, despite which several patients experienced analgesia, which has been attributed to the suppression of cholecystokinin. Even genetics plays a role, which contributes to polymorphism to the response to placebo, and it forms a placebome. This genetics effect is seen on several hormone enzymes like MAO oxidase inhibitors, COMT dopamine receptors, and tyrosine hydroxylase, which in turn affects the performance of opioid receptors, which in turn affect the dopaminergic system. The third group is the doctor-patient relationship, which facilitates adherence to treatment and increases trust of the patient. How do you take the medical history? What is the medical history? What are the complementary tests you are getting done along with the medication? Are there any special explorations like endoscopy? Is there an informed prescription for the drug? Are you explaining it to the patient or not? It is to be understood that an empathetic doctor-patient interview triggers a series of complex psychoneuroendocrine mechanisms in the brain, which over the course of human evaluation lead to trust, pleasure, and positive expectations. A smiling doctor, a talking doctor, a well-groomed doctor, a doctor wearing a white apron, a doctor coming with a stethoscope, all of these create belief. And this belief in a medical professional prepares the patient to heal. There are some other factors like the natural evolution of the disease, which tends towards improvement or cure, the phenomenon of regression towards the mean, whereby the disease will automatically cure over a period of time, the Rosenthal effect, in which the observer gives less importance to symptoms reported some time ago, and the Hawthorne effect, when the act of measurement influences the value of what is being measured. We see that there are several papers, particularly in depression, in pain management, and in psychiatric conditions, which document the successful use of placebo. Placebos have been used in cardiology for hypertension, heart failure, to decrease cardiovascular mortality, and in pulmonology for asthma, cough medication, and a lot of chronic diseases related to allergy like chronic itch and atopic dermatitis. And the most famous of them, which we see day in and day out in OPD, the irritable bowel syndrome. So not only medication, even there is surgery. In placebo and surgery related things, there is an expectation of healing from the intervention. There is a lot of trust with the surgeon. So it is not cruel. At times it can be very effective. It is commonly practiced in spine operations, in vertebroblasty, in CABG, where they ligate internal mammary artery for the treatment of angina. Of course, in sham operations, they don't operate. Freezing of the duodenal ulcer via endoscopy, and in arthroscopy. Actually, without operating, the doctor is able to convey the benefit to the patient by doing a sham surgery. But it should be done only when no other design will yield the same data. And important attention should be paid to the informed consent process. It is not justified when testing the effectiveness of a minor modification to an existing procedure. It may be justified if it is known that the disease being studied is susceptible to a placebo effect. The effect should be relatively small, and most importantly, the patient must be offered the opportunity to receive the standard treatment if it is found to be efficacious at the end of the study. So we come to telling your patient that you are giving a placebo. The use of inert substances in clinical trials as well as in the clinic is under discussion, where the patient knows that he or she is taking the placebo, but there are ethical concerns involved. Even in Amazon, you get several commercially available placebo which claim to support digestion, emotion, sleep, and comfort. So, in clinical trials, placebo automatically find a very important place. It is seen that the placebo response helps. The placebo effect causes spontaneous remission, regression to the mean, and response biases are minimized. Placebo at times cure a significant number of patients. Almost 54% in some studies are cured by placebo alone. In clinical trials, the placebo is the clinical researcher's analog to the scientist's control experiment. If we want to prove a new treatment effective, then double-blinded placebo-controlled trial is regarded as the gold standard for testing the efficacy of new treatment. You can see when our colleague medical representatives bring a lot of data, this data contains a significant amount of patients who show good results in the placebo group. Over a period of time, if placebo is given, there is a higher benefit noted in several patients. So post-treatment analysis, the inclusion of placebo is very useful. It gives a baseline for comparison. It helps in elimination of bias. But there are ethical considerations, when to give, when not to give. The psychological effect of giving a placebo has to be considered. Randomization and blinding in placebo-controlled trials is very important. We should understand natural history if the patient is going to get cured on his own. Safety monitoring is required so that the placebo arm of the trial patients don't come at a risk. Regulatory requirements should be in place. Resources should be optimized to offer the best to our patients, and there should be a valid endpoint which should be defined well before. But the argument against placebo-controlled trials is that they are unethical. Why? Because as per the Helsinki Declaration, in any medical study, every patient, including those of the control group, if any, should be assured of the best proven diagnostic therapeutic methods, and no patient should suffer from any unnecessary pain. This problem comes more so upfront in children, where a major takes a decision on behalf of the children. The children are highly affected by seeing other patients responding to the same drug, where parents feel that it is good for their child. There is associative learning in such children. And if there is a good patient-physician relationship, automatically the drug will work more. So, placebos in randomized controlled trial are for proven therapy when they are highly regulated, when there is a higher hurdle for comparative study between two known drugs, when there are flaws in non-inferiority designs, and when there is a publication bias. But it should not be used when the disease carries an unnecessary risk of disease and death and morbidity, and when there is a need for comparative effectiveness between two drugs, when better study designs are available, and when it is just done to avoid publication bias. Basically, the mantra for a successful outcome in treatment with the knowledge which we actually gain from placebo is that there is a triad of deep belief in between the doctor who is prescribing the drug and the efficacy of the drug. If the patient believes in both of them, then definitely even an inert drug like placebo will give a good effect. Thank you.
Fantastic. Fantastic.
Good evening, everyone. I hope you are seeing that slide of CCA Con Calcutta, 6th CCM Calcutta that is happening 22 to 24 August. So we request all of you. Vijal, the slide is playing.
Yeah, it has been displayed already.
Hello.
It has been displayed.
Okay, fine. So please be there without fail for the 6th CCA Con Calcutta between August 22, 23, 24. Please be there. Our dear friend Dr. Rajadhar is the organizing chairman. let us join our hands and let us show the presence of CCA family at Calcutta. Thank you. Rakesh Bhai, over to you.
Thank you, Krishna Bhai. On behalf of again Krishna Bhai, I also invite you for the CCI Con in Calcutta. My slide is visible. Okay. Thank you, Ravi Bhai, for a wonderful presentation. You covered all with creating an effect ki placebo is effective. You have given a positive message about placebo. Before this panel now, I also have taken a confidence pill, which coincidentally looked exactly like a breath mint. Feeling great though in this strong, witty panel. The placebo effect is a proof that if you think you are getting better, you might just be right. It is a medicine version of fake till you make it. Ancient rishis did not have double-blind trials, but they did have double the confidence. This is what in the beginning has been told. The good doctor makes the patient happy and makes him believe what he is going to write will cure him. Doctors say across the world, laughter is the best medicine. Unless you are in a clinical trial, then it is probably a placebo. So you get all right. Every day in the morning, you have the laughter clubs across whole nation, and they are approved and they are effective. Now, we are going to discuss today from studies on placebo effect with literature search from PubMed, Google Scholar, Science Direct database, placebo in clinical trials, placebo effect in pain, placebo effect in Parkinson's, placebo effect in depression, placebo response, neurobiological responses, and placebo in respiratory medicine. The whole discussion is from 396 articles with 74 studies which were finalized. So I start the panel discussion with my elite panelists, putting down to Radha Didi, what is the placebo effect? Tell us brief about its history and how does it work? I am audible?
Am I audible?
Yeah,
Yes.
Radha.
Yes. First of all, thank you, CCI and Dr. Krishna, for choosing a topic which and making it so relevant and so scientific that it would definitely open up our minds to not only how medicines work, but something which works like a medicine. So thank you for having such a topic. Thank you for bringing me on board as a panelist here. And thank you now, Dr. Chawla, for that question. So when Dr. Ravi made a presentation, he has clearly given us a historical aspect. And we know that placebo effect in medicine represents one of the most fascinating and enduring therapeutic phenomenon which governs the mankind. It has had a very remarkable journey from ancient healing to what we now see as modern placebo effect, which has been analyzed with the help of various neuroscientific studies, investigations, and the backup data, as Dr. Chawla has mentioned in various studies. So the term itself, placebo, is Latin, as most of the words in our medical literature comes from either they are French or Latin words. So placebo means I shall please. That definitely means that a positive, a healing, or a pleasing effect of something, be it a drug, be it a ritual. And then way down from that, 14th century or the 13th century or even before that, it has traveled down and have gone through many phases of studies. And now in modern science, we do have something as placebo therapy. And then after the therapy comes the placebo effect. Dr. Ravi has already explained the scientific part of it, how it acts at the central nervous system in the frontal cortex region, where something that you give is perceived as a treatment. And because it is labeled as treatment, not only by the doctor who is giving you, but also by the patient who receives it, he in his mind has accepted it as a therapy. And then how that is why his body starts accepting it as a therapy and responds to it based on various neurochemical reactions that happen in the mind. The various Dr. Ravi has already listed which various hormones or neurochemical transmitters are released, and it gives a positive effect. On the other side of it, I want all my fellow panelists, as well as those in the audience, to also correlate this with their various experiences, either in the childhood or in the adult. You would have seen that in villages, if there is a snake bite or a scorpion bite, there would be people who would be chanting something and saying कि इसका जो जहर चढ़ गया है वो हम उतारेंगे. I have looked at it very scientifically and I know कि ये जहर उतारना is not possible whenever there is a bite by a poisonous snake. But then we as doctors and as human beings must understand that there are various side effects even if the snake is not poisonous and people lose life. And here वो जो कुछ भी मंत्र है, वो जो कुछ भी रिचुअल है, जिसमें वो पेशेंट का फेथ है, जिसमें वो परफॉर्म करने वाले का फेथ है, it acts and it saves you from the catastrophic effects of psychological shock of a particular bite और द रिएक्शन. जैसे स्कॉर्पियन बाइट में माइनर रिएक्शन अगर आने वाला है, तो बिकॉज ऑफ फियर इफ दे वुड रिस्पॉन्ड वेरी ड्रास्टिकली, probably few, I'm not saying all, but few of the lives are saved. And now going to the lighter side of it, all of you have heard Vaijayantimala singing, mantra bhi jhoota, वैद bhi jhoota, and वो जहर तो चढ़ ही रहा है पापी, चढ़ गयो पापी बिछुआ. So if it is really poisonous, it may not help or may help you to hold a food. But if it is non-poisonous, जो fear psychology है, जो shock psychology है, it helps you to overcome and survive the crisis. Thank you.
Very, very, very well said, Radha Didi. And they, in technical terms, talk about the psychobiological response, the expectations, as you explained, conditioning, reduced anxiety and stress, and the brain chemistry which has been elaborated, the release of endorphins to make you that whatever is going on is going to make you all right. And people have measured this positive brain activity with PET and MRI. So absolutely correct, Radha Didi. Coming to another star of the show today, Agam Bhai, what are the different conditions where placebo work?
Wow.
Is it
Good evening, everybody.
or a mind game?
What are the different conditions where placebo work? Is it true only or mind game? Good
Or
evening,
mind-
everybody.
And give a mention about habitual cough or a functional dyspnea. Atri
Yeah,
wanted
true.
to listen this also.
True. I think if this was not working, half our practice would go away because we can't really identify the cause of cough in so many cases. We can't really identify cause of breathlessness in so many cases. Having said that, thank you CCI for giving me this opportunity. And who else? It's got to be Krishna. Who would think about such topic? And there would be such interesting discussion. I never thought there can be a topic like this. And when I was looking at last couple of years program, not a single program repeated, and that's what is beauty of CCI. And when Chawla sir takes up the discussion, when I have excellent panel with Ravi Bhai being the beginning stroke, and then Radha Didi here, and then everybody, it makes it so special. Trust me, mind game. It's all about mind game. वो कहते हैं ना, if you don't mind it, it does not matter at all. Since Dr. Radha Munje spoke about that song. It reminded me of that, Dil Aya Gadhi Pe To Pari Kya Cheez Hai. So it's all about Dil, it's all about mind. And whenever you look at study, so Chawla sir, whenever you look at study, the study is definitely with a pinch of salt. There is bias. The studies are always influenced. And I can't think of, most of the studies which I believe are influenced. मुझे और एक कोट याद आता है अगेन कृष्णा भाई ने बहुत पहले बोला था थोड़ा जोक तो होना चाहिए तो कृष्णा भाई स्पेशली फॉर यू आई वाज लुकिंग एट अ study on fertility and I realized that fertility is hereditary. So if your parents did not have any children, very high chances that you won't have either. Look at this. How funny is this? There was another study which I came across which says that people who celebrate more birthdays live longer. Interesting, isn't it? As Krishna Bhai, you said, I never knew how those treatment worked. Even my father was a family physician, and people would come to him for days of cough, and he would give one syrup and one yellow tablet, one green tablet, and this is taken care of. All that abdominal pain, the loose motions, etc., would get better with just one tablet. And I never knew how can an infection settle without 5 days, 7 days, 10 days of treatment. But yes, placebo definitely works. So it's like a dummy key. मुझे always याद है कि वो एक dummy key है. It doesn't open the door. Somehow the lock is not unlocked, but still the alarm system is convinced and it starts buzzing. So it works the best for that symptom relief. मुझे लगता है इन्फेक्शन ठीक ना हो शायद कैंसर ठीक ना हो शायद ऑर्गन फेलियर को कुछ ना हो बट दो सिम्टम्स वुड डेफिनेटली गेट बेटर एंड विद दैट जो भी डिस्कस हुआ कि it may be playing with patients' expectation with those release of multiple mediators in the brain. It may be conditioning. It may be brain-body pathway. It may be anxiety relief. Ab jo bhi naam do. But this is fascinating because there is a clear demonstration that mind can influence your body. So there are no active ingredients in it, but it's patient's belief, which actually is a game changer and brings about so much of improvement. And even more interesting is, what? The open label placebo, when even patients are aware that they are taking a placebo and still it works. And it works as, Ravi Bhai showed, it may be the color of the pill, the size, the brand name, etc., has got impact. And yes, Chawla sir, as you asked me, what conditions I've seen it working. I practice only respiratory. I've seen it working in all those breathlessnesses, all those coughs, functional cough that you talk about, those non-specific chest pain, non-specific myalgias and body aches and etc. And I'm sure a lot of this preparation, those gabapentin and whatnot, CoQs, etc., everything is only placebo effect and not the real effect. Thank you very much.
Thank you, Agam. This makes me remember when I was in Saudi Arabia, so they are Badus. Badus means the government wants them to remain uneducated, stay in the desert, and give them all facilities to keep them in desert so that the country identity is maintained. They walk to the city, to the hospital, and believe it, they may be having pockets full of money. But faith on the system, because Ministry of Health is governed by the all expatriates. They will come, go to Dr. Bathaniya, that is Doctor of Medicine, Dr. Sadar, the doctor of chest, Dr. Al-Galb, cardiologist, and Humiyat, fever, and Dr. Sukkar, diabetes. He will go with different prescriptions, sit with him, and they are wise enough. If Dr. Sadar is writing a medicine for pet, he says, Dr. Bataniya Mojud, that medicine doctor is a pet ka doctor. He will write medicine, don't write. Then he will bring prescriptions for all Sadar, Al-Galb, Humiyat, and all. He will sit down outside on a pavement. See who has given the pink tablet. All pink, very good. This is all right. Take it. Yellow, this is very good. White, same. Baki kullu kharban. Kullu kharban, throw them in the dustbin. ये 3 गोलियां बहुत अच्छी हैं. And believe it, he will become all right.
And it works. Fantastic. True.
Game. What you explained, so it was reminding me of old golden days of Saudi Arabia.
Nice, Rakesh bhai. May I interrupt 1 minute?
Yes, Krishna bhai.
I extremely loved that funny talk from Agam and followed by you, Dr. Rakesh bhai. Or I will tell you this, adding to this humor,
Uh,
if a patient comes to you with multiple symptoms, like perhaps he has got 7 to 8 complaints, and if you write 1 or 2 pills, he will look at you thrice. I have 8 symptoms, he has written 2 pills.
So, well said. And this
Great. And
placebo,
just Ravi, thanks a lot. Beautiful presentation. You made my day.
thank
Thank
you,
you.
Krishna
Go
bhai.
ahead, Rakesh bhai. Go
Not
ahead.
only
Rakesh
your
bhai.
Thank you,
day,
Krishna
those
bhai, for the
1900
info.
friends who logged in today, everybody's day is big.
Let me check it. It must have exceeded now. It is 2243.
Ah,
Good,
wow.
great,
Only CCI can help you connect to this 2200 friends at a time. I'm so
correct.
happy.
No, no, it is increasing. I will put it at the end, the total
Wow.
number of
Wow,
logins.
wow,
Thanks,
wow.
thanks, Krishna bhai. We expect you to have inputs in between with the light humor. Thank you, Agam bhai. So, to summarize, it helps in migraine, low back pain, Parkinson's, respiratory dyspneas, functional dyspneas, and whatnot. So we are talking placebos work. Well, Ravi bhai, you have explained very nicely nocebos and placebos. I am sure you better than you. Nobody is here now to explain about the positive and the negative effect and what are the mediators. You have shown us beautifully, and we expect you to show the same.
Sir, basically, placebo is a inert drug which doesn't cause any effect at all, but because of the perceived benefit by the patient's brain, it will give benefit in the form of relief of symptoms. At the same time, nocebo is a drug which causes harm or which supposedly causes harm. This harm can be caused by the mindset of the patient, and it can cause any symptom like nausea, vomiting, altered sensorium, all abdominal pain, loose motions. Everything has been documented as an adverse reaction when nocebo effect happens. Some commonly seen nocebo situations are like when we use statins. A lot of people have statin side effects. The benefit is very less, but still statin prescription is very high. Similarly, although recently only just now AIMS ICMR study has come in favor of COVID-19 vaccine, but up till today, lot of people attribute everything that has happened post-COVID to either remdesivir, the doctor who gave steroid, or to the COVID vaccine. So this is sort of a nocebo effect whereby a negative mindset is made कि ये हुआ है तो मुझे ये बुरा हुआ है. That is the nocebo effect. And there are several hormonal changes also behind this. Placebo basically is benefited, means the neurotransmitters in our brain, like Krishna sir told, endorphins are released, dopamine is released, cannabinoids are released. They help in the feel good phenomena or the belief phenomena. Whereas there is a hormone called cholecystokinin, CCK. If this CCK is more in quantity, then nocebo effect or the negative effect comes. So placebo decreases CCK and increases dopamine and endocannabinoids, endorphins, whereas nocebo increases CCK. That is in a nutshell.
Very nice, Ravi bhai. And what a question before was the mind game. If you just before this topic, what Krishna thought, had we be standing just having a cup of tea together and discussing there is anything like nocebo, maybe we might not have believed.
Yes, sir.
Now going through this literature, getting the evidences, yes, nocebo effect is there again a very big mind game and a positive effect again a mind game. So great. Coming now to Atri bhai, very excited. He has taken a leave today to participate. I am also excited to listen comments from Atri bhai. What is a placebo in clinical trials and why they are the gold standard and how they standardize the drug efficacy? And
Okay.
I promise the audience you will listen all the truths and the stalwarts are here, Krishna bhai, Agam bhai, Radha didi, Atri and Ravi Dosi bhai. So believe the questions which are going to unfold will make you excited and we look forward for you to put us the questions in the chat box. Please, Dr. Atri bhai.
Yeah, first of all, thank you for the opportunity, because what I understand, this is going to be a watershed webinar. After this webinar, lot of professors watching this will assign thesis on placebo to the students. Lot of people passing out, or people who seek employment in the pharma industry, they may think of orienting their career in trials vis-a-vis placebo. I remember a nursery rhyme which sounds very relevant when we are talking about placebos. One for the master, one for the dame, one for the little boy who lives down the lane. That is, one medicine for the master or chief complaint. Then think of placebo, one for the dame, regarding your reproductive women's history, etc. One for the little boy who lives down the lane. This is placebo for all your petty complaints, etc. So now when I come to clinical trial, whenever we are talking about a new disease, so we don't even know what is the treatment for this disease. So when we don't know what is the treatment for the disease, so there is no question of withholding treatment to cause harm. So when there is a totally new disease of which the treatment is not known, so there we can definitely compare any investing drug with respect to placebo, and there will not be an ethical consideration that we are withholding any proven evidence-based treatment. For example, post-COVID pulmonary fibrosis. Lot of respected senior people say, why give antifibrotic? Lot of people say, what may be the role of steroid? What may be the role of bronchodilator? What may be the role of acebrophylline? What may be the role of montelukast? But post-COVID pulmonary fibrosis is a totally new disease. No one knows what is the treatment. When no one knows what is the treatment, then there is something known as the dictum of no harm. During treating someone, I cannot cause more harm to that person. So, bingo, placebo becomes the gold standard. If there is no established evidence-based treatment, then rather than doing harm, because the following medicine may cause teratogenesis, oncogenesis, mutation, LFT, KFT, pancreatitis, uveitis, placebo does not cause harm. Placebo become the gold standard. Drug efficacy and placebo, the role was elucidated by Dr. Ravi, so I would not repeat those slides. But now I think everyone can understand why placebos become gold standard in somewhere, and why can trials depend on placebo whenever we are talking about new diseases. Over to you.
Thank you, Atri bhai. I will honestly submit, in our internal medicine, we have few diseases which we have a cure, right? Rest we are symptomatic doctors. Lot of time patient has limitations. You want to write all plethora of investigation, you cannot write. He honestly says, I cannot afford. You write some medicine, he says, डॉक्टर साहब 5-7 दिन लेके देख लेता हूँ, काम चल जाएगा, ठीक हो जाऊंगा, तो क्या करवाने की जरूरत है? ये फेथ है. Diseases, people are doing the conferences on diseases like bronchitis, interstitial lung disease. As Atri said, post-COVID fibrosis, patient when he is in, you have 10 topics on ILD, different topics, different diseases, different pathology. When it gets into progressive pulmonary fibrosis, everything is coming into PPF, and it was hypersensitivity pneumonitis, it was ILD, it is NI, the IPF, it was NSIP, all is getting into progressive. You don't have a disease, you don't have a treatment. Doesn't work perfenadone, doesn't work nintedanib. This is where placebo helps you. Because if you convince the patient this is a new medicine which has walked in for you, believe it, it works. Nothing is working. He is progressively dyspneic. He is on the 5 liters, 6 liters, 8 liters of oxygen. Progressive dyspnea, what you will give. This is where the placebo, even what Atri bhai has said, 30 to 35% in these chronic diseases research has proved placebos work. Thank you, Atri bhai. I liked your nursery rhyme. It reminds of the children, my children, when I was in Saudi, Aditya was born. So went up the hill, went down the hill. We used to be with him in the video cassettes, and we used to. Thank you, Atri bhai. Radha Didi, now how placebos cause physiological change? How it works? How the pain is relieved? There should be something which is going to relieve. How it is doing? This mind game, what is the science behind?
Yes. First of all, let me tell you, the eye see what the mind wants to. The mind knows and understands what it really wants to. Otherwise, that interpretation is not done by mind. So, it is not a mind game, but I would say the whole game is played on the turf of your mind. That is how it happens. The placebo effect is not psychological, but it's a real thing, it's a measurable thing. And the biological changes occur in the brain, not in the mind. Mind has perceived, and now the changes are for real, which is happening. Changes are not happening in the mind, they are happening in the brain. Okay, so there is a release of neurotransmitters, the brain activities are altered, the immune responses are evoked, and thus at the terminal end organ, physiological modifications occur. And all this, as you have earlier mentioned, we have evidence of this. And as the medical field advances, so do we have different investigations where mapping can be done. So earlier we had only EEG, which would record the activity of changes occurring in the brain. Now we have PET imaging possible, which looks at the brain, and you can give even the radioactive radio tracers, which really lets you know what changes have occurred with the placebo treatment and what has been recorded when that particular mind or a brain or a person is responding positively to the placebo. What actually happens is that opioid receptive selector radio tracers have been seen. That means that dopamine system is activated, and various neurotransmitters like dopamine, the serotonin, and other endorphins, various happy hormones are relieved, which in turn goes to the site of action and the body responds. So that is what we have, and we have had enough evidence for that. And there is evidence of increase in the dopamine and opioid activity after placebo administration, and that is why more and more studies and evidence is available. For one is studies done for pain, whether they are local or generalized, and that is why placebo even works in fibromyalgias. Then more studies are done where there are psychological disorders like depression, and where these the drugs or the placebo has positive effect. So it is in the mind first. जो गोली लेता है, जो दवाई लेता है, उसके माइंड में आया है कि मैंने कुछ लिया है which is going to help me to come out of this particular disorder or pain or something. और एक बार जब वो एक्सेप्ट कर लेता है, then the brain actually starts working to give the positive effect or the placebo effect. So that is how it happens. तो हम कहते हैं ना कि फला फला डॉक्टर के हाथ का, आप जहर भी पी लो तो भी अच्छे हो जाओगे, फला फला जगह का आप पानी भी पी लो तो अच्छे हो जाएंगे. तो दिस इज बिकॉज मेरा फेथ है, मेरा फेथ मुझे हेल्प करता है टू एक्टिवेट इट. to make everything scientific, which was earlier not scientific. वो पानी साइंटिफिक नहीं है, लेकिन उसका एक्शन जो है वो साइंटिफिक होता है, just because my mind has accepted it.
Thank you, Radha Didi. It reminds me of the start of the webinar where the doctor, as Krishna Bhai said, with a stubborn face, patient walking in with the end of life diseases, end stage COPD, end stage pulmonary fibrosis, end stage grade 4 metastatic carcinoma. Doctor knows I am not able to help. At least he smiles. His staff smiles. He gives the medicine with the happy mood and happy mind, having positive vibes and positive talk.
Yes.
बकवास, अब तो कुछ नहीं हो सकता तेरा. तुम गया सारी उम्र, तुमने साला सिगरेट फूकी है, अब फेफड़े भी फूक गए. And rather than talking a positive things, I am sure this is where the doctors help you to release more of the endorphins and the CCK like cholecystokinin, like enzymes, they help the patient to be all right.
Yes.
Very well said, Radha Didi.
And my apologies if somebody is feeling hurt, but that is how many of the alternative medicines also help people in healing faster. This has been scientifically studied with हम जो दवाइयाँ लेते थे होम्योपैथी की. I'm not talking about the scientific part of it. It is a science in itself and it does help. लेकिन कई लोग जो दवाइयाँ लेते और कहते हैं मुझे यही दवाई सूट करती है, इसी से मैं अच्छा हो जाता हूँ. तो all this starts in the mind, but it works on the brain, and brain in turn rules at the site of action.
Very nice. Let us
Rakesh
not...
Bhai,
sir?
one may I have permission to speak?
Yes. Welcome, sir.
Just other than the treatment aspect, something flashed my mind now regarding the endorphins. Okay, so you have some tiny backache or tiny spasm, everything, something you have, but you are going for a meeting where you need to attend and meet your friends, like, for example, CCI Kolkata. So those tiny pains will never bother you. Till you go, they will become highly active, super active, everything. Someone like yourself, Dr. Rakesh Bhai, who annually conducts Respicon. So whatever is there, everything will go off till you finish your Respicon. But after that, you come back home, every pain starts and you start sleeping off. So the fun of endorphins, this is. And,
so can I quickly interrupt Krishna sir? I remember our own Kripesh Bhai, he conducted that Northeast conference with high fever, and the day we left, he had to be admitted for 3 to 5 days, including platelet. But the 2 days he was running around, doing everything, gave his talk, managed everything. Endorphin effect. We saw that.
Exactly. And I strongly recommend regarding my previous, this one, that a doctor should be always clean shaved. He can have mush. No, I'm coming to you, Agam, coming to you and Rakesh Bhai. He can have mush or he can be clean shaved, but he should not be like some KGF Yash. That is for sure. Okay. But however, the people who have hair loss here are allowed to have a French beard.
What a relief.
Let me tell here another interesting fact of Saudi Arabia. I was in a place in Qasim, which is a god of Mutawas. Mutawa means the religious leaders, where Imandari say they are able to follow the namaz 5 times. The person, only one non-Muslim, Hindu, with Om on his hand, with kleva, they will say, Daktur anta twice. Hada mafsud, because this is a Saudi style of beard. They will say, this is mafsud, bas hada mafi koi. ओम लिखा हुआ बढ़िया नहीं है, बाकी डॉक्टर तू माशाल्लाह बहुत बढ़िया है, दाढ़ी तो A1 है. So I'm telling you, the दाढ़ी is quality long way back when I was there. So दाढ़ी has got its own quality.
I think it is regional. I didn't quote the regional differences here.
It becomes a brand. It becomes a brand. Very nice. Because patient से वो दाढ़ी वाला जो chest specialist है ना, वो कहते हैं या तो अगम है या तो चावला, और तो कोई है ही नहीं हिंदुस्तान में.
Brilliant. Please go ahead. Please go ahead.
Coming to another wonderful question and honest submission from Agam, I need ethics of placebo controlled trials. What is considered unethical? I don't want any diplomacy. An honest answer: are we Indians? And is pharma allowing us to practice? Or we fell prey to their tactics? Agam bhai.
A very interesting discussion going on. So before I answer that, you blamed cigarettes, and somehow I thought I must defend them. Cigarettes are, trust me, incredibly useful. It helps you lose weight. It actually helps you lose your lifespan, and it saves you a fortune of your retirement planning. उससे बढ़िया क्या हो सकता है? Well, sometimes, as Madam was saying, treatment is all about entertaining your patient long enough till nature decides to take care of it. And the best you can entertain, the best time you can spend, give placebo, whatever. And most of the times, if there was no placebo, I'm sure a lot of our patients will not be able to help at all. Having said that, the question is about ethics and issues. Are we following it? So if you look at ICMR guidelines says that vulnerable population. By vulnerable population, what we mean: bache out, pregnant lady out, elderly patients out. I mean, you all know how do we do this trial. Remove all those patients, and they should not be exploited. That is what ICMR says. And placebo should not lead to avoidable suffering, is what is ICMR statement. And same is the declaration of NSK, which says that benefit, risk, burdens, effectiveness of new intervention must be tested against the proven available interventions. So if I have to tell you what are the ethical issues, the ethical issues would be no proven effective treatment if it is not available. Say for any disease, if there is no effective treatment available, then yes, maybe you are considering you are justified in considering it as ethical. I would say probably I like somehow add-on trials. That means there is a standard of care and some new intervention. If you add on to it and try to understand what kind of implication it has, to my mind, that is better. And the intervention has to have minimal risk and it is of minimal duration. Probably that makes sense. But to my mind, unethical would be withholding some effective treatment. Say you're giving instead of insulin, you give something else to a diabetic patient, which is seen in multiple trials, which is available on net. And to my mind, I think it is unethical. If you have some serious side effects or disease which are progressed, say you have a cancer or a stroke or a heart disease, I would be reluctant in considering a placebo controlled trial, and I would call it probably unethical. And of course, if there is no transparency or if there is no informed consent taken, probably this would be unethical. I was looking at web, I was searching net, and I realized a couple of such issues. There were some controversial issues in 1990 in Africa when actually AZT was stopped to prevent mother-to-child HIV transmission, and some placebos were given, and that led to a lot of issues, and which was strongly criticized at international level. There was some trial which I can't quote, but I remember somewhere which said that there were some issues in prescribing certain drugs to suicidal tendency patients. There were some strong antidepressants available, but still other drugs were given, and that was again debated, and again there were some issues with it. So if I have to summarize the ethical trial to use placebo would be when there are no existing effective treatment available. When it is a design where you are giving add-on, you have a standard of care and you are giving add-on, I would consider it more ethical. And I would consider it unethical when you have to stop the proven therapies when there is a potential for some irreversible harm, or there is probably lack of informed consent. And a lot of us are involved in clinical trial in India, and we know that most of this trial are compromised. To some or the other extent, there is some compromise. Thank you.
Very well said, Agam. I agree with your honest submission. All trials with the present medicine, effective medicine, we should not make our patients guinea pigs. Already effective treatment, they have all the rights to have it. And having said that, we should try to avoid to be part of such trials where just for the heck of it you are doing it, to increase your prescription base you are doing it. So I am sure this message is very strong. We are all well aware of it, that how we are used, and the kind of trials done in India against approved drugs are definitely compromised. Very well said, Agam Bhai. Now coming to Ravi Bhai, placebos writing, is it ethical? And what is your opinion about Bhasma, which are very popular because Radha Didi said they are all effective. I also agree with her statement. We don't have to shun a pathy. It may be Unani, Homeo, or it is an Ayurvedic medicine, because we do not know the details of it. We just have heard the hearsay. What is your opinion, Ravi Bhai, about is it ethical to prescribe? And what do you think, Bhasma or the sweet pills of homeopathy, can we put them, integrate into our medicine?
Yes, sir. Very, very important question, because most of our patients with chronic diseases tend to follow and take these medicines as a part of their prescription along with our medicines. As far as prescribing placebos, sir, open label placebos are available in the market, but giving a patient by telling him कि भाई ये चीज placebo है, कुछ करती नहीं है, फिर भी आप ठीक हो जाओगे, if you are telling the patient and giving, then I don't think that it is wrong. Because sometimes, like, we see situations where really our standard medications don't help. We have to add on things which we also don't know won't work, but our word of confidence and word of comfort to that patient help in making that thing work. So it is ethically correct if you're telling the patient and giving it. Secondly, if you are in a life threatening situation, then definitely only the hope that you can give will add to it, but we should not give anything which is not time tested, because we are bound by our own Hippocratic oath, Hippocrates oath, and our ethics. As far as Bhasma, sir, I live in Indore. मैंने आपको भी महाकाल के लिए मेरा वो विनती अभी भी है. हम तो महाकाल के पूरे प्रांगण में ही है सर. तो भस्म आरती यहाँ की बड़ी प्रसिद्ध है. और जहां तक भस्म की बात है सर, तो the problem with all of the indigenous medications and these items are that their concentration is not defined. They have varying concentration and their sources are also not properly defined. So I think we practice the Western system of medication. So I don't think it will be ethically correct for us to prescribe it. Although अगर कोई लेता है और वो उससे ठीक हो रहा है, तो मैं मना भी नहीं करने वाला हूँ. I think वो placebo, the confidence that he
Absolutely,
has in it, the confidence that he has in it will help my medicine work better. That is what I can say. As far as homeopathy is concerned, sir, there is a paper which I have quoted in the presentation which actually says that homeopathy is placebo. It is a documented indexed paper, sir. But at the same time, I have so many patients, relatives who actually are taking homeopathic and they are improving. So I cannot deny that fact also. At the same time, bound by my own ethics, I will only support them and write my medication. As far as indigenous, if it is not harming my patient, I will just supporting कि भाई ये भी ले ले, पर मेरी जरूर लेते रहना.
Very, very well said, Ravi Bhai. I was going to talk the same
Rakesh Bhai, an important interruption. This webinar is not meant, never meant to tell the other systems are wrong.
Correct.
We have no knowledge regarding them.
Correct.
We respect.
Absolutely.
We definitely respect homeopathy, Ayurveda, Siddha, Unani, okay, and yoga.
Yes.
Okay, we definitely respect them.
Yes.
We basically do not carry any knowledge regarding them, to talk regarding them. They have been existing since centuries or since more than millennium here.
Correct.
So we have no rights to tell that these are not working, these are wrong.
Correct.
We do not have any knowledge regarding them. Hence, only we are not commenting on them, and we are not even justifying that they are good. We are not telling that they are bad. We are just silent here for the reason that we don't know them. That's it.
Correct.
We don't know them. That is a very important message from us to rest of the all other specialties here that we are not defaming you. It's not our job. You are doing excellent, but we have no knowledge regarding that. Kindly forgive us.
Correct. Very well said. I endorse Ravi bhai and Krishna bhai. पेशेंट आता है कहता है मैं पहले तो 4-5-6 महीने से होम्योपैथी ले रहा हूँ, यूनानी ले रहा हूँ, पर इस बारी मैं बेटर नहीं हो रहा, तो क्या मैं वो भी साथ साथ ले सकता हूँ? आप ले सकते हो. डॉक्टर साहब आपका कोई कमेंट अबाउट दीज मेडिसिन? आई डू नॉट नो, बट आई डू नॉट डिस्कार्ड देम आल्सो. आप ठीक हो रहे हो, यू प्लीज कंटिन्यू टेकिंग इट. एज रवि सेड कि मेरी दवाइयां भी लेते रहो, so that you should become all right. We want to be sure that you are all right. Very well said. Now coming to Atri bhai to listen another nursery rhyme. Clinical equipoise, a new term which I read when I was preparing the webinar. Atri bhai, to throw a light, what is a clinical equipoise in placebo controlled trials?
Excellent. Here equipoise means we should be very, very clear that where our going forward as an investigator may harm the person and where our not going forward can fail to uncover new evidence. So this is a very big dilemma. There cannot be any guideline to define this, to put the inclusion or exclusion criteria. Ultimately, this will come from seniority, experience, and somewhere instinct. Somewhere when we are in a trial and we are thinking about this equipoise, something comes like trust my instinct. But yes, as Dr. Agam reiterated, by respecting the ethics. I am giving a very, very simple example. At one point of time, again, let's talk about this COVID pandemic only. Even we were calling up our doctor colleagues who had recovered from COVID. Please give plasma, please give plasma, please give plasma. I have this one patient in ICU and I think he will get intubated tomorrow. We used to get the plasma. Some people did not survive despite the plasma. Some people got better. We did not know why, whether it was due to plasma or not. But then ICMR strongly came up that no, plasma was basically placebo, and for future treatment, we are not even keeping these plasma banks. We are not asking the COVID recovered people to donate blood for this plasma. So here equipoise means that basically when we are in a strong placebo controlled trial whose design is very good, but we know that even after continuing the trial, the patient is having some adverse effects, then there can be a decision that this patient should be dropped from the trial. And if a significant number of people have that adverse effect, that no, then maybe this trial should be stopped. For example, in IPF, pulmonary fibrosis, that Panther trial, multi-arm Panther trial had actually to be stopped, one arm of that. And when we are talking about, let's say, vaccine-related trial, if we are not getting any adverse effect, so despite not having evidence, vaccine versus placebo, we often continue the trial till the end point is received. So I hope I could explain this equipoise to all of you.
Very well said. Very well said. When the proven therapy exists, don't take away the rights of the patient. If he is developing side effects, he has to be stopped and taken out rather than for the prestige of mine, I continue such kind of trial. Very well said. So, Radha, yes, Krishna bhai.
Rakesh bhai, one thing has to be sorted out strictly. You continue taking that system of medicine also and add hours.
Correct.
Then the outcome has come from which we will never come to know.
Correct.
If you are confident about that system, you go ahead taking that alone. And if you were to be confident taking that for 6 or 8 months span, why did you come to me? Then when the patient asks you, can I continue to take them along with your drugs, the allopathy drugs? If the same question he asks to them, what will they tell? That is a matter of significance here. So if someone like confident like us, we can tell them that we need not the cover of those to cover our illness. So only with our system of medication, you can become all right. But what about them, how they are telling to their patients, we never know. Because I've had a huge bunch of people who have been telling me that the other system of doctor told them, you please continue without fail taking the allopathic drugs, but never discard these. So the outcome of which is unknown here. Like a person is getting treated from myself and Agam simultaneously. We both are treating the patient. The patient is fine, but who made him fine? Agam or me?
Obviously,
God
you.
knows. No, 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 no.
There is no second thought about it.
No, 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 no. It is just for the
Very
sake
well
of
said.
comparing. So this particular, I'll not name a few large television brands which come in the news channels or everywhere or somewhere, that even some movie actors come and endorse them. इसका कोई side effect नहीं है. Okay, so like that, if they are feeling completely better with that, they shouldn't have visited us. No, curiosity question.
Correct. Very well said, Krishna Bhai. So that the decision is left to the patient, that you decide who has made you all right. Your medicine which you are not getting relief, or the medicine which you have taken for 5 days and you have become all right. Very well said. We can put that and put the foot down. Please stop that and take this medicine and compare and see what is happening. Because again, this is a debate. We do not want to, as you said, we don't want to get into controversy. We want to walk straight. And I'm coming to Radha Didi now.
2952 logins final.
Wow, great.
Wow.
2952. Great. Cross.
Great.
2952 final.
Any panel discussion. Very nice. I am
Yes.
again ill-hated because I have taken the placebo sugar pill when I came for this. Now, Didi, they are talking about the
Whenever
trial.
I'm off the screen, you should understand that I am going for a placebo.
Okay. So, Radha Didi, what are these trials? The single, double blind, placebo, open label? Please enlighten us, and the use of placebo in clinical trials and medical practice.
Yes. So we have to understand, and as all of us in this panel, and most of the people who have logged in, they surely know that whenever there is any study, जब आप आपका पीजी का थीसिस भी जब करते हैं ना छोटा सा, तब भी जो आदमी लाइक ड्रग्स देता है या जो उसका इफेक्ट मेजर करता है, उसमें बायस रहता है. एक बायस यानी हमारे दिमाग में वी हैव रिकॉर्डेड समथिंग कि इसका ये इफेक्ट आएगा. So, for example, a new drug for hypertension is being tried. Or let us talk now of our own specialty. People now have a concept that glycopyrronium is something which is going to help all their COPD patients, irrespective whether they are from the class A, B, E, whether they have had exacerbations or not and hospitalization. ये एक bias है because everybody wants to have a miracle drug. But when you are conducting a trial, such type of bias does not help. You are going to come out with very wrong findings, and biased अगर आपका finding noting है तो the findings are being vitiated is the word which is used for trials. तो ये bias, there are many bias, selection bias कम करने के लिए हम randomization करते हैं. If you will allow me 2 minutes to explain, because you have asked me about clinical trials, and this is something which I have been speaking in most of the workshops also. Selection bias क्या है? अगर मैं डॉक्टर हूं और मुझे पता है एक नया मॉलिक्यूल आया है जिसका स्टडी हो रहा है, and I believe it is good one, and if somebody comes, whether the patient is well known to me or my relatives or my friend या उनका कोई brother sister relative आया है, I will see to it that they will get this new molecule. And I will not let them go to the old molecule which has been standard of care or to the placebo group. तो ये हो गया सिलेक्शन बायस. इसको अवॉइड करने के लिए सारे स्टडीज में रैंडमाइजेशन होता है. And randomization, which is not what you and me think. कि पहले 5 ये ग्रुप में, दूसरे 5 वो ग्रुप में, is not randomization. पहला वाला alternate numbers here and even numbers there is not randomization. So randomization either वो block से होगा या computerized cheat से होगा. So randomization is done to avoid selection bias. Then blinding is done. Blinding इसलिए होता है ताकि द डॉक्टर को भी पता नहीं है पेशेंट को क्या मिल रहा है, आपका जो कोऑर्डिनेटर है ट्रायल का उसको भी पता नहीं है क्या मिल रहा है, स्पॉन्सर को भी पता नहीं है कि पला पेशेंट को क्या मिल रहा है इन द स्टडी. दैट इज blinding. That can be double blinding, triple blinding, various ways, so that you are honest enough to record not only the positive findings, but even the side effects or the ADRs or the adverse events which occurs. जो छोटा सा भी सिम्टम अगर कोई बोलता है पेशेंट तो दैट हैज टू बी रिकॉर्डेड वेरी प्रॉपरली. दैट इज वेरी इंपॉर्टेंट. देन द प्लेसिबो जो हम ट्रायल में यूज करते हैं दैट हैज टू बी एग्जैक्टली लुक लाइक, feel like, packed like, preserved like the actual drug. यानी अगर एक्चुअल ड्रग को रेफ्रिजरेट करना है तो प्लेसिबो को भी करना पड़ेगा. ऐसा नहीं हो सकता कि प्लेसिबो कबर्ड से निकाला और ड्रग डीप फ्रीज में से निकाला. So these are the things which has to be done to avoid the bias and to have a proper recording of the outcomes, the adverse events, and any event which was not expected but has occurred in the study. So this is one. Then second question is, do placebos outperform the active treatment? Most of the time, placebos do give some positive effect. So to the tune of 20 to 30% of the people in any study might say that they have had a better outcome even with placebos or have benefited. There are very few studies where the placebo may have outperformed. And that is only because if the adverse events are more, or whether, the some trials have failed because there have been high expectancy at the endpoints and the side effects have been more. So that is how it is when we talk about the placebos and the studies.
Thank you.
एंड ऑफ कोर्स इट डिपेंड्स कि आपके स्टडी का एम क्या था. अगर आपके स्टडी का एम है कि हमको वी हैव टू शो दैट दिस ड्रग इज नॉन इंफीरियोरिटी स्टडीज जो हम बोलते हैं, तो आप उसी हिसाब से उसका आउटकम आएगा एंड विच विल बी कंपेयर्ड विद द प्लेसिबोस.
Thank you, Didi. Very well explained. But I, with folded hands, across these 3,000 audiences, will say, if an effective existing drug is there just to make pharma happy, don't get into a double-blind, double-arm studies where you
double
dummy using these fascinating, very strong words. They are used only for the discovery of the new drug, effectivity of the new drug, not the existing drug, which when you say ki this I will get it published in American Thoracic Society, this will be published there, I will ensure them. Sab bhai bhatijawad hai, sab scratching the back. You scratch my back, I scratch your back. Please don't get indulged into these fascinating big names only when you are discovering a new drug, and I am sure that is done under high quality circumstances where they invest not thousands, millions of rupees to get discovery of the drugs. They are making us also guinea pigs to use us to authenticate their medicines. Why you are going far off? Talk about your biologicals in asthma. See how the selection is done. See how the injections are being used. So I don't want to get into details. Again, I remind of Krishna
to
bhai,
make everything light.
No controversy.
Yes, to
Agam
make
bhai.
the topic lighter, Dr. Chawla, let me add, अगर किसी को देखना है double blind, they should go and watch the Hindi movie Angur, where Sanjeev Kumar and the other one,
मौसमी चैटर्जी.
नहीं मौसमी चैटर्जी नहीं, वो दूसरा वाला उनका,
Deven
I'll
Verma.
get back.
Deven Verma.
Deven Verma, yes. वो दोनों ने मिलके जो किया है हंगामा, I always call it as a double blind trial.
Oh, great. Very great.
मुझे
Agam,
तो मैडम
you mentioned about the guideline. So from human research protection, please enlighten us whether there are some guidelines with for the ethical consideration which are enforced on the trials.
सर इफ आई मे बी अलाउड, मैडम जो बोल रही थी उसके एक्सटेंशन में मुझे बोलना था, वो सिंगल ब्लाइंड एंड डबल ब्लाइंड बोले तो मुझे सिंगल ब्लाइंड डेट एंड डबल ब्लाइंड डेट के बारे में याद आ रहा था. आई रिमेम्बर कृष्णा टॉकिंग अबाउट इट वंस कि व्हेन यू फाइंड ऑन टिंडर अ मैच इट कुड बी कॉल्ड single blind date, and when both of them do not know whom they are meeting it could be a double blind date, and it's very interesting. I also remember one old joke which I can't resist but to share, and that is how these studies are done and how we take it into consideration. So you put ice in a glass of water, it floats. So it is called observational study. You press that ice down, it goes down, sinks, and again comes back. It is called experimental study. You randomize ice and stone in two different glasses. Ice floats and the stone sinks. It is called randomized control trial. You meta-analyze all these ice and water experiences globally, and it is called Cochrane database. You submit your ice experiments to a conference or present it on a platform like this. It's called free paper presentation.
Yes.
You publish all your ice experiments in a renowned journal, and it's called evidence.
Evidence.
But if you put ice in a glass of vodka with lime syrup and have it with a friend like you all, Krishna, it is called practicing evidence-based medicine.
Medicine.
I wish we can practice that evidence-based medicine here.
Wow, great. Very well said. Agam, this is what I was expecting from this channel to listen all these things.
Brilliant, Agam. Brilliant.
Very nice. Very nice. So
you asked about
the guidelines, if there are
ethics
any
guidelines. Oh yes, there are various guidelines available. We have AMA code available. We have Helsinki's declaration available. We have global guidelines available. We have HRPP guidelines available. They all tell you the same thing by and large, and they tell you if there is a proven therapy available, the justification has to be a strong justification. There has to be a strong scientific need for trying something new. They cannot be deprived of standard proven therapy. There has to be informed consent, and if at all you have to do this intervention, it has to be for a shortest possible duration. So if I have to put it everything together, if there is no proven or acceptable treatment available, if there is a strong methodological reason to doing, informed consent, monitoring and rescue plan, and duration and exposure of this placebo is minimum, this is what is the guideline tells you. And then there are certain red flags. I would say that continuing placebo after evidence which supports the efficacy is unethical. That means you're doing a trial, within a shorter period you realize it is working, it is not working, continuing it beyond may be unethical. Non-disclosure about placebo and at risk again is unethical, and longer duration and the treatment where there could be irreversible harm could be unethical to my mind. Thank you.
Very well said, Agam Bhai. And I want Ravi to now put in the words and pitch in the ethics in consent in the country, which is 80% in villages and illiterates. Do you really, and 20% population is in the cities and metropolitan cities. And if you see the fashion of trials is all in these fashionable metro cities, not in villages. And the population which is catering these cities and the physician is from the villages. Do you really follow the protocols of consent? What should be done? Or is it done? Or again, पेशेंट को पेपर दे देते हैं, पेशेंट साइन कर देता है, उस पे सब कुछ लिखा होता है. सच क्या है वो बता रवि.
सर देखिए, सच बात तो यही है कि मतलब it depends, sir, situation to situation. But jitna jo standard, what is recommended is everything that you do has to be explained to the patient, given in written, and signature has to be taken, informed consent. But at times when we have to convince for the benefit of the patient, then we talk in a way that ki usko baat samajh mein aa jaye easily. We don't complicate it with a lot of technical talk. That is what I would like to limit myself to, sir. But jo tarika hai, ethically most important, never to use placebo in situations which are life threatening या फिर जिसमें कोई effective treatment already established है. At that point of time, it is very unethical to use a placebo. If all the treatment options are exhausted, all documented treatment options are exhausted, patient is still not getting comfortable, or the patient is persistently asking for thoda और कुछ तो करो डॉक्टर साहब, क्या करना है आगे, in that condition definitely then we have to go ahead and prescribe a placebo in known conditions, sir. So
Before,
sir,
please continue.
Rakesh bhai, one question for Radha ma'am.
Okay.
Yes.
Radha ma'am?
Yes, I'm there.
Okay. Radha ma'am, frankly speaking, this should be haunting everyone amongst us, but nobody has raised this question till date. Everyone, beyond pulmonologists also. Whenever we start a patient on ATT,
Yes.
do we tell the patient, make him sit and tell that, is it your kidney failure could happen with this, your liver failure could happen with this, you could lose your eyesight with this. However, whatever it is, you want to take it or not?
No. Shall I answer very honestly? Shall I answer? Can you hear me?
Yes, ma'am.
Yes. We do not tell this, but I make it a point, and many times I write in vernacular also. You will feel heaviness in the stomach. You will have feeling of nausea, not feel like eating. But
ma'am, excuse me, ma'am.
Listen.
I do tell my patient, I have some these things.
Listen. But we never say कि आपका liver fail होगा. हो सकता है ये दवाई से आपको थोड़ा पीलिया हो जाए, तो before it increases you have to report back to me, right? About ophthalmic, I truly agree. We never say you will lose your vision, but we do tell इतनी सारी दवाई खाते हैं, कुछ ना कुछ साइड इफेक्ट होगा. आपको दो चीज करना है, not sit at home and not stop the medicine on own. ये दो चीजें तो I categorically explain to them. So this is very important.
Few things are very pertinent from my side.
Yes.
You will have a red colored urine.
Yes.
Don't bother. You will have itching and rashes.
Itching.
Don't bother. You will have GERD, severe discomfort. You will lose your food taste. You will lose your appetite. These are all okay, ma'am.
Yes.
I'm talking regarding this particular things, which may not be everywhere, but are definitely. But I'm not even telling that they are in microscopic also. They do happen with a sizable population. But we don't tell them. First, ma'am, let me complete. This is for the very reason that eliminating TB is very important task for us in this nation. And if we ourselves tell them that this is going to happen like this, that, this, they will never take it.
Yes.
This is the first point. But second point is, however, getting them, once you start ATT, after a week span, getting an LFT, RFT done, and after a month span, getting their fundoscopy done, isn't that a good thought?
Yes. But that is what, what happens is, Dr. Krishna, let me be very clear. ये जो practice है ना, what you have to explain and how you have to follow, this is being adopted by everybody individually as per their experience and as per their own rationality of mind. Right? So sometimes we feel that after a month or so, there is no need to repeat LFT because enzymes will rise in the first few weeks, right? In the first 1 week, 2 weeks, 3 weeks, like that. But then there are people who would keep on calling the patient every 15 days, keep on doing LFT. तो ये मैं, बट आई एम नॉट हियर टू ब्लेम, क्रिटिसाइज और इवेल्युएट. मैं ये बोल रही हूँ कि इट इज द रैशनैलिटी विथ विच द क्लिनिशियन और द ट्रीटिंग कंसल्टिंग फिजिशियन जो भी है वो करता है. तो वी लिव इट टू देम टू मैनेज देयर पेशेंट्स वेल. एंड देयर आर पीपल, जो पेशेंट बोलते हैं आके कि हमको डॉक्टर साहब ने बोला था, लेकिन हम फिर फला फला के यहाँ गए, उन्होंने बोला दवाई सूट नहीं कर रहा, आप बंद कर दो. तो वी कम अक्रॉस मिसहैप्स मोर.
दीदी, आई एम श्योर, जैसे हम कॉन्फ्रेंस में कहते हैं ना, ये लंच टाइम में you can catch hold of Krishna and convince him with these all discussions. I am sure both of you. So we will discuss in the dinner time, and both of you will be discussing and asking each other. I will be moving ahead to quickly catch up. Ravi, सच्चाई यही है, अगर पेशेंट को सच बता दें, विलेजर को, कि ये प्लेसिबो है, इफेक्टिव ट्रीटमेंट है, उसके अगेंस्ट तुझे ट्रायल में लिया जा रहा है, कोई एक भी पेशेंट साइन नहीं करेगा. दिस इज माई take on this question. And now I am moving ahead fast because I'll take away few questions out. Children's, I will pick up definitely. Ethics in children's. Do we practice ethically when children are unable to give consent and the parents are giving? So Ravi, again this question is for you, and tell me how you will. I am taking away the placebo commonly, intentionally. Radha Didi has already explained. Emerging technologies are all there in these trials because I am getting instructions to finish it fast. I am very interested. The children's topic should be touched. And Ravi, please comment ethics in placebo in children. Do we really follow, or again children are the guinea pigs by talking irrational to the parents?
Sir, it is very right. Children are very much influenced by their parents' behaviors, and it is the parent who decides what the child will take or not take. The parent can be influenced by कि अरे उनके बच्चे को कुछ दिया था, वो ठीक हो गया, उस डॉक्टर के पास गए थे, वो बच्चा ठीक हो गया. They can give sugar, they can sugar pills, they can give some colored water. It is okay if the parent is giving it in a situation which is not harmful. लाइक किसी को पेट में हल्का फुल्का दर्द है, कोई सोने के लिए टाइम पे नहीं जाता है, तो एक माइनर कंप्लेंट के लिए कोई प्लेसिबो मेडिसिन किसी पेरेंट ने या किसी डॉक्टर ने किसी बच्चे को प्रिस्क्राइब कर दी, तो दैट कैन बी एक्सेप्टेड. बट इफ अ चाइल्ड इज सफरिंग फ्रॉम हाई ग्रेड फीवर, कुछ सीजर आ रहे हैं या कोई पोटेंशियली डेंजरस सिचुएशन है, तो उस टाइम पे वी हैव टू अवॉइड दिस. इट हैज टू बी ट्रीटेड इन अ प्रॉपर साइंटिफिक एंड प्रोटोकॉल बेस्ड मैनर. ये चिल्ड्रन का सिचुएशन ऐसा है कि पेरेंट्स का बायस बहुत होता है, एंड देयर इज अ ह्यूज interference on the thought process by advertisement, social media, and hearsay. That is why we have to be very careful as far as using placebo in children is concerned.
Very well said, Ravi. I want Atri, if you can have some rhymes or couplets beyond sugar pills, injections, and sham surgeries. Please, quickly, Atri, you talk, and before to your favorite topic of respiratory medicine. Another 5 minutes, I will close. So Atri, please.
Sugar pills have been the favorite placebo because they taste wonderful. And except diabetic people, sugar pill cannot cause harm. Sham surgery is something more difficult because the surgery is sham, but the anesthesia is not sham. You need proper nil orally. You need proper PSC check. And then you need to instill the proper anesthetic, may it be halothane, may it be fentanyl, may it be whatever. And after that, you need to put a proper incision and then do nothing. So sham surgery involves proper anesthesia. So the ethical consideration in sham surgery is more difficult. Sugar pill is definitely easier. But yes, again, when we are talking about advancement of science and proper consent with videography has been taken and we are not causing harm, then if the situation demands, it should be encouraged. There should not be blanket discouragement कि नहीं ऐसा नहीं होगा. There should be avenues where when certain criteria are fulfilled, that provision should be there.
So Atri, these VR glasses which you enjoy at the conferences, brain is not able to differentiate between the real and the digital program, do you think these help in the sham surgeries?
Somewhere, yes. Virtual reality simulation. Virtual reality simulation.
Correct. You have seen Prime Minister playing with the keys and wearing that VR system of Meta and getting into the real world of the games, and you are involved, your brain is involved, and you are lost. People say you are easy to wait and don't keep anything around you because you will also be involved in this whole show and you do not know where you are. So brain is not able to differentiate the digital and the real. Will it help?
Somewhere, this robotic surgery has its roots in that sham surgery. It started from there, and now robotic surgery is coming up in a very big way where it is actually saving lives. That someone like Dr. Chawla, who is sitting at Delhi, is operating in a rural patient of Jharkhand who cannot be flown to Delhi with robotic surgery. So somewhere this thing started from sham surgery.
Very nice. Very good. Didi, please talk about placebo in respiratory. I will like to listen Atri in between if he wants to talk anything. What is the role of placebo in respiratory medicine?
Dr. Chawla, we all know, and we are all in respiratory medicine since years, and we know placebo does help. I would give two examples. One is when you have hyperventilation, which is psychophysiological response, and this is something helps to the drugs which are placebo. We are actually not treating. Then there is psychogenic cough, to which we treat and give so many things, but it is mainly the placebo effect, and that is only when such patients respond. That is a second one. And others are, I won't be quoting placebo results, but then even the inhalers that you give, we all have come across patients जो बोलता है कि वो the contents are the same and you just change the name, and somehow the patient feels that this drug or that particular inhaler is better than the other one when you yourself know that you have not changed the ingredient. So this is how you have those placebo effect. That is what we say.
Just interrupt, ma'am. Just
Yes,
interrupt,
yes.
ma'am.
Yes. Another, just a moment.
अच्छा ठीक बोलिए मैम please.
And another thing is what pharmacologists or what pharmacopoeia or what FDA says is a totally irrational combination of drugs and should not be prescribed. These are the drugs which always act best clinically, even if they contain a combination of mucolytic and a drug suppressant at the same time.
Yes,
and this I think is थोड़ा बहुत scientific और उससे ज़्यादा placebo effect है.
Okay. Atri bhai.
Placebo effect in inhaler is because dyspnea is subjective. Before marriage, when someone is doing pre-wedding shoot, he is picking up the fiancé and clicking photo. There is no dyspnea. But after marriage, when that wife is asking him to lift the cylinder, he is unable to lift the gas cylinder, citing dyspnea. To the best of my knowledge, the fiancé weight is more than that of the gas cylinder. So how you can lift fiancé, how you cannot lift gas cylinder? So dyspnea is subjective. Inhaler effect by changing the brand name on dyspnea definitely works. Another very big example in pulmonary medicine is costochondritis.
Yes.
Till now, we don't know what is costochondritis. We label a symptoms where everything is normal is costochondritis, and what works on costochondritis can be a debate of our CCI con.
Very nice. Thank you, Atri bhai.
Atri bhai, I had a small query. What happens when wife is replaced with girlfriend?
Then they can change cylinder, they can give microwave oven also.
Interesting. I like this experience.
Agam, Dr. Atri, you quoted an example.
Real life experience सुनने में इतना मजा आता है.
Atri bhai forgot to mention that camera has a wonderful placebo effect.
Wow, great.
So whether it is in your mobile, a selfie, anywhere, it has a wonderful placebo effect.
And it releases endorphins.
Yes.
Just for Agam,
Very nice.
for his question regarding wife and girlfriend.
in respiratory medicine, there is a famous quote, please, placebo does not clear the airways, but it may clear the mind.
Yes.
Rakesh bhai,
Yes, sir.
just for Agam,
Huh.
you asked me wife and girlfriend. What's the difference when he tries to lift?
This time
Okay.
is not from my panel discussion. This is extra taken and given by Krishna Bhai. Please continue.
Boss is always right. Yes, boss. Yes, कृष्णा बोल रहा था.
हाँ
बहुत
हाँ,
इंटरेस्टिंग
कृष्णा
बात है.
भाई
नहीं
बोलो.
नहीं बॉस जब तक मना करे तो दिल्ली
नहीं,
दिल्ली
मैंने
होती
मना
है
नहीं
भाई.
किया. मैंने
Delhi is
मना नहीं
Delhi.
किया.
Dr. Chawla,
Delhi
you
is
cannot
Delhi.
refuse. We need to understand
Delhi is
this
Delhi.
real life experiences of Krishna Bhai is going to be useful. 3,000
कृष्णा भाई,
people want to learn
मैंने
how to manage
कृष्णा
wife
भाई
and
मना
girlfriend
नहीं किया.
together.
Just
Who else can throw this light?
okay. No.
Please,
Not really an experience.
कृष्णा.
Actually,
I can see you blushing.
okay. I'll just finish it in 2 minutes only.
Correct.
Okay. So, girlfriend, boyfriend. The boyfriend initially has Royal Enfield 350, and he takes the girlfriend always for a ride, sitting behind him. But she keeps talking whenever they go for a long ride. He's unable to hear her because of the sound of the 350, Royal Enfield 350. So immediately before marriage, he sells it off and buys a Honda Activa so that he can hear her every word when she is sitting behind and can keep hearing her all the time when he rides. After 1 year, he sells Honda Activa and buys Royal Enfield 500cc.
And which bike you have?
I have a Honda Activa. So concluding remarks, you can go ahead,
1
Rakesh.
minute, last ever in the history of CCI, one question debate which has never happened. We are happening it today. This is the last before concluding. In favor of placebos are underused. I request Dr. Radha and Dr. Agam shortly to comment, and against that placebos are overhyped. I want to listen Ravi and Atri. One liner quickly to coming to the closure.
Madam first, ladies first.
Yes. I agree that in our practice of respiratory medicine, we use less of placebo because we prescribe, but we never convince our patient that this is going to help you. आप ये गोली ले लो, आपका खांसी चला जाएगा. इसके बाद आपको आना नहीं पड़ेगा. We never say that very confidently. So I feel we are using placebos lesser and lesser, and there is rather a large scope for that. But yes.
So I would say that never underestimate placebo.
Yes.
It's the only drug that works without fail,
Best.
without any side effect, and even when everybody knows it's fake. आपको भी मालूम है, आपके पेशेंट को भी मालूम है, इवन वो केमिस्ट को भी मालूम है. So don't ignore the placebo. And कहते ना ये सब मस्तिष्क की बातें हैं. It's all in your head. But trust me, head is where brain is. Thank you.
Atri and Ravi Bhai, against that placebo
When we are thinking
overhyped.
of structural lung damage, we cannot depend on placebo. We need to stay far ahead, far away from placebo, because dependence of placebo may unclear the diagnosis, may cause some permanent lung damage. Dr. Ravi.
सर प्लेसिबो अगर पेशेंट को सही में पता चल गया प्लेसिबो है तो वो कभी कभी डॉक्टर पेशेंट के बीच के ट्रस्ट को तोड़ भी देता है. इसलिए वी शुड गिव व्हाट इज करेक्ट. जो इफेक्टिव ट्रीटमेंट मौजूद है वो देना चाहिए. अननेसेसरीली प्लेसिबो देके हमारी बात को डाइल्यूट नहीं करना चाहिए.
Very well said. I am with both the pro and con debaters. Personally, only if no better option existed, but ethically, we need to treat as agreed with Agam, Radha Didi, Ravi, and the Atri Bhai. Before we wrap up, I will like comments from each of the panelists who have done a wonderful job on this difficult and unusual and making it so interesting. I am sure Krishna Bhai will disclose how many are still glued to our show before I give final comment. Yes,
Three
Agam,
indications
Radha
in
Didi.
pulmonary medicine. Three
Yes, please.
indications in pulmonary medicine: costochondritis, functional dyspnea, habitual cough.
Very nice. Agam bhai.
You are muted. Dr. Agam, you are muted.
Oh, sorry. It's not the pill, it's how you feel. Belief alone can sometimes heal. So before you laugh and say, no way, remember, placebo saves the day. Thank you.
Yes.
Very nice. Radha Didi.
Yes. If you really want to avoid a pill, just take a chill pill. The placebos should really help you, and our prescription should go down with a proper use of well explained placebo.
Dosi bhai.
Sir, doctor, drug and belief, all three are bound by belief. अगर पेशेंट आप पे बिलीव करेगा, पेशेंट डॉक्टर रिलेशनशिप स्ट्रांग रहेगी, तो आपका जो मेडिसिन है वो हमेशा हेल्प करेगा. यू विल गेट प्लेसिबो एंड नेवर अ नोसिबो.
Very nice. Krishna bhai.
After you choose this webinar topic, then I dwelled further and I could read a shocking, important stuff that the overall sale, it is not mentioned by me or by CCI, by some reputed doctor globally, and he quotes that the overall sale of non-allopathic real drugs in the entire globe is 5 times huger than the allopathic established drugs. 5 times huger, which he terms as placebos.
Great piece of information. So remember, folks, if you leave today feeling better, we won't ask whether it was the discussion or just the real strong AC in which you are sitting. I once told a patient their pain would disappear if they wear a tinfoil hat, and surprisingly, 50% felt better. And I'm still not sure it was the hat or me what made him better. So,
your charisma.
Your charisma. Correct.
It is you and your hat.
Okay. So I close with these remarks with folded hands. Thank you again, Krishna bhai, the CCI panel, for giving me opportunity to moderate this wonderful session on one of the rarest topics. I, with folded hands, I am stop sharing so that we are visible on full screen.
On behalf of all of us,
Fantastic moderation, sir.
Attend CCA Con Calcutta 22 to 24.
Yes.
Please, August. On behalf of all of us.
Yes.
Rakesh Chawla bhai, brilliant moderation.
What a moderation.
Keep seeing you further like this.
Yes.
Thank you.
Brilliant moderation and a brilliant idea, we really had to read so much about it, and we learned so much about it.
And because of Krishna, I had to do so much of research and share with you all, because I don't bring surprises, because all of us are on the same platform. We are all one. This was my thinking from the beginning of the webinar.
Bringing you in was not to cherish you, to torment you.
Thank you.
Thank you.
Thank you.
Shubharatri. Good night.
Shubharatri. Thank you very much.